Growing up, life was good, but our whole family had weird things going on. Half my body would go numb, half freezing, half sweating. My arm would stop working, and no one knew why. And it's like, okay, just keep going. Went to college, and then in medical school, it started getting worse. And I'm like, I am so exhausted. I'm so overwhelmed that I can't see a patient. I'm like, I'm gonna have to drop out. And they said, no, you're depressed, you're stressed, typical. I'm like, no, I'm not. And it's got to the point where I'm not gonna be able to do this. But I was a very evidence-based physician. I still am very evidence-based, but it's ingrained that if anything's integrative, alternative, precision, it means no evidence. No one's helping me and I'm dying. I'm just sweating and anxious, everything's fight or flight. And so I sneak off to some of these alternative conferences. And I'm like, what the hell? These are more evidence-based than what they're teaching me in residency. But I ended up with Lyme, Babesia, Bartonella. And then so, like, oh my gosh, went to family practice, opened up a center, thyroid optimization clinic, just converted to cash in a year because we were just treating so many people. No advertisements, it just worked so well. Because probably 70% of the population has low thyroid, that they can benefit from taking it, but their tests look normal. So just based on that, it just took off. Stress is a killer. People think stress lowers your immunity. No. It modulates it. So it lowers that Th1, which gets stuff inside the cell. It gets cancers, intercellular infections, and Th2 gets stuff outside the cell. So it goes like this. Same thing with aging. When your thymus involutes, it's like this. Any stress, any chronic illness. So that's why you get all this sickness as you get older and with more stress. Even the CDC says above the age of 60, every person has at least one condition that is caused by the involution of the thymus. So we become an immune modulation clinic. So, but I ended up by chronic Lyme. We got it in utero. Just again, going through stressful divorce, just bedbound. Could I get a bed? Just sweating. And then I went into heart failure. My heart was so fibrosed, it was like a severe diastolic dysfunction. My heart was fibrous. Think about it. It needs to fill and then contract. Fill. It couldn't fill. So I couldn't stand up. I couldn't walk upstairs. And I'm like, I go to the cardiologist. He's like, maybe in 10 years you get 10% better. Okay, I'm going around the world. I'm going to cure myself, or I'm going to end it on Halloween. And so I went around to Mexico, did stuff with Omar Morales out there. Was around in Europe, and I went and did a bunch of peptides. I didn't think anything about them. Didn't know about peptides, but did them like 3 days later. I just walked up the stairs. Wait a minute. What happened? I can stand up. What's going on? No, it can't be that. I'm trying to think what it is. So I went back, did it again, like 2 days later, feeling pretty good, So I'm like, oh my gosh, we got to bring these to the U.S. Took about 2 years. And then that's when we kind of were able to push it out there and kind of end up being through tailor-made pharmacy. But changed my life. Like I was on 3.5 years of the highest IV antibiotics you could ever imagine, 7, 10 at a time, 3-4 times a dose. Did nothing. I kept ending up in the ICU, and I remember the nurses were making a shift change. They're like, this is that AIDS patient who keeps turning up negative for HIV. Because I had no immune system. So with no natural killer cell, no Th1, you can take so many antibiotics, but the body has to take over. So if you have this part that's so low, then, you're not going to do it. But if you're up here, so if we use, like with chronic Lyme patients that had, many years, the sickest and the sears and all these things, that maybe we don't have to do antibiotics, or maybe 2 months, not 5 years, things like that. So, and thyroid optimization changed my life. High dose T3, it just gets you a different level, and you can combine them. So I feel blessed. I thought at some point that when people have like Lyme, Babesia, it's horrible, but there is hope.